Good morning to all. I am Prof.Manavalam. Now we are going to see about the case presentation on postpartum hemorrhage.
Good morning to all. Good morning, ma'am. Today we are going to see about the case study presentation. So case study presentation about the mother. She got admitted. Now I am going to read about the case scenario. 29-year-old female got admitted in the postnatal ward after her delivery. So on the day of delivery, her vital signs are stable and also the vaginal bleeding within normal limits. So the bladder condition also good. So following that, next day morning, she had the profuse bleeding and also the having the feeling of dizziness. So immediately the attendants they went on to the nursing station and informed to the nurses in charge. So the nurses in charge they immediately went to the mother bedside and they started to monitor and assess the mother. So while monitoring, the vital signs are dropping, the pulse rate are increasing, the blood pressure are reduced. So this bradycardia as well as tachycardia and hypotension which will be present to the mother. So while doing the abdominal examination, they found out that the uterus is feeling very flappy, soft in nature, and also vaginal bleeding is dark in color, and also it is normal. It is more than the normal limits. So these are the findings they found out. So this is the certain signs and symptoms. Can you guess the condition? Yes, the condition of this case scenario is PPH, postpartum hemorrhage. So postpartum hemorrhage means the vaginal bleeding that is occur inside the genital tract or outside the genital tract following the delivery, but the amount of vaginal bleeding is more than 500 ml for normal vaginal delivery or more than 1000 ml for cesarean delivery, means then it is considered as a PPH, postpartum hemorrhage. There are two types of postpartum hemorrhage are there, primary and secondary postpartum hemorrhage. Primary postpartum hemorrhage means the hemorrhage that is the bleeding in the genital tract that is occur within 24 hours after the delivery, that is called as a primary PPH. Secondary PPH means the bleeding that occurs after 24 hours of delivery, means then it is considered as a secondary PPH. Again the primary PPH, again it is divided into two that we will see later. So this is the major things. Next we move on to the causes of PPH. So the causes mainly the 4 T's are responsible for PPH. So the first one is the tone. Tone means the uterine tonicity. So main reason of the loss of tone is atonicity of the uterus. Next second T is tissue. So any retained placental bits that is present inside the uterine cavity means that also reduce the tonicity of the uterus. So that is one of the reason for bleeding. Next move on to the trauma. Any trauma to the genital tract, especially the laceration or operation or injury into the genital tract, inside the genital tract means that leads to hemorrhage. Next fourth one is thrombin. So the patient already had any coagulopathy or coagulation related disorders, means that the mother more prone to develop hemorrhage during postnatal period. So these are all the causes of PPH. Next, how we have to assess or know whether the mother is having the diagnose the PPH means first we have to monitor the vital signs. Automatically the pulse rate which will be higher. So the mother needs to have the tachycardia and hypotension. The mother will have the feeling of dizziness, pallor, and at the end the mother more prone to have it enter into the state of shock. So these are all the signs and the symptoms which will be present for the mother. And while assessing the vaginal bleeding, it is more than the normal limits, that is more than the 500 ml for normal vaginal delivery mothers. So while assessing the abdomen, the uterus usually feel like a soft flappy in nature. The vaginal bleeding is dark in color. So through this we can differentiate, we can conclude that the mother is having the PPH. So immediately it is one of the postpartum emergency disorders. We have to give immediate concentration to the mother. So what are the management do you know for this PPH? Do you know? So first I will explain the emergency management. Immediately after you are seeing a mother with PPH means you have to call for extra help. That is the emergency. Next you have to start the IV line. So IV line you have to start with a large bore cannula. 18 gauge or lesser than that you have to start because we have to infuse more amount of fluid to this mother. Next you have to start the infuse the crystalline solution 1 liter up to 1 liter and follow the hemosil also you have to infuse to this mother. Meanwhile you have to check the if it is monitor the blood group of the classmate. Blood group has done means we have to check the blood for classmating and we have to arrange 2 liters of blood transfusion for this mother. And you have to catheterize. If it is not catheterized means you have to immediately catheterize the bladder. So if the bladder is getting distended means automatically it affects the tonicity of the uterus. So you have to catheterize the bladder. So this is the emergency measurements you have to first line measurement you have to do. Follow that you have to check the uterine atonicity. If you are finding that because of uterine atonicity the mother had mostly this mother is having PPH because of atonicity of the uterus. So that's why these are the measures we have to follow. Follow that we have to next line of management we have to start the oxytocin drip. 10 units with a normal saline 1 liter we have to start and then we have to keep the drops rate 40 to 60 drops per minute we have to keep the drops rate. So after following the oxytocin drip next you have to assess the every 15. One more thing I left out, vital signs you have to monitor every 15 to 30 minutes. So again you have to check the abdomen. Again it is atonic in nature means you have to explore the uterus. Uterus you have to exploration of the uterus is essential and examination of the placenta if it is not, no need of that or worry about that. So you have to explore the uterus and next you have to start to give the oxytocin. Again you have to start to infuse the oxytocin. Followed that you have to give the prostaglandin. Mainly the misoprostol you have to administer 1000 microgram per rectum you can administer. So this one you have to do it. And the injection method 0.2 milligram you have to administer as a IV. So this is the second line management. Follow that again you have to check the fundus. Again it is atonic in nature means next you have to move on to the next measurement. So next you have to use the balloon tamponade method or either you can pack the tightly you have to pack with the gauze the uterus and the bimanual compression you can give. This is the third line. Next fourth line you have to move on to the surgical measurement. So surgical measures you have to do the ligation. We can shift the mother for ligation of internal iliac artery, ligation of uterovarian artery they can do or else they can do the arterial embolization procedure. At last again the uterus is atonic in nature means next you have to move. Rarely you can make the mother to move on to the hysterectomy procedure. So this is the line of management for PPH. So sorry for this. One more thing I left it. So after immediate measurements, emergency measurement, first you have to give the fundal massage. So fundal massage, why you have to give it? You have to make the fundus to hard and then make the fundus to contract. For this purpose, you have to do the fundal massage. Are you clear?